Let me ask you something real quick. When your lower back hurts, do you ever wonder, why does this keep coming back no matter what I do? Here's the shocking truth. For most people over 50, low back pain isn't random. It's not just aging, and it's definitely not something you have to live with. In fact, after more than 30 years of treating backs just like yours, I've seen the same exact problem over and over again. And today, I'm going to show you how to tell if you have it, what's secretly causing it, and 4 simple exercises that can start fixing it, sometimes in as little as 30 seconds. So don't blink, because this next part might explain years of pain you couldn't understand.
Believe it or not, most chronic low back pain after 50 comes from one joint. It's called the lumbosacral joint. That's the very bottom joint of your spine, right where your spine meets your pelvis. And here's the scary part. This joint is the most abused joint in your entire back. Why? Because every time you sit, slouch, sink into a couch, or sit up in bed with your feet lifted, that joint gets pushed backward, jammed, and irritated. Over time, it stiffens. It stops moving the way it should, and suddenly, pain shows up out of nowhere. But here's how you can tell if this is your problem.
See if any of this sounds familiar. You sit for a while, then stand up, and it takes a few painful seconds just to straighten. Bending down feels stiff. Lifting groceries feels risky. Putting on socks or shoes feels like a chore. Your back is tight first thing in the morning. Or maybe rolling over in bed sends a sharp reminder through your lower back. If you nodded even once, trust me, you're not alone. And most people never get told why this happens, which is exactly why it keeps coming back. But now, let me show you what's actually causing it. Here's the truth nobody tells you. When your back sags backward while sitting, especially on soft couches, or sitting up in bed, that lumbosacral joint gets forced out of its natural position. And if your back already hurts, doing this makes it worse. So from today on, never sit in bed. Never lift your feet up while sitting. Instead, sit all the way back in your chair. Support the natural curve of your lower back. That one change alone can reduce irritation. But now comes the part you've been waiting for: how to fix it. This first move is powerful, and for some people, it brings relief in under 30 seconds. Lie face down on a firm surface. Slowly lift yourself onto your elbows. Now pause and listen to your body. If this causes sharp pain, stop. That may mean inflammation, and we'll skip ahead. But if it feels good or just a little stiff, relax right there. Hold for 30 seconds. Breathe. Let gravity do the work. This gently moves the joint back toward where it belongs. Do this every night. Over time, build to 1 minute. And if it feels good, you can gently bend one leg at a time. Just a little movement. But wait, this next exercise is where things really start to change. Now we want to open the joint, and rotation is the key. Lie on your back on a bed, knees bent, thighs vertical. Slowly rock your knees side to side. Only go as far as feels comfortable. For some people, that's halfway. For others, it's almost all the way down. Do this for about 30 seconds. Then, let one leg hang off the side of the bed. Face up, chest open, hands resting comfortably. Let gravity gently stretch your lower back for 20 seconds. Switch sides. This is how professionals release this joint in practice, but you're doing it safely at home. And now comes something most people completely overlook. There's a deep muscle in your lower back
called the multifidus. And research shows when this muscle gets weak, low back pain keeps coming back again and again. So let's wake it up. Get on your hands and knees. Look straight down. Gently tighten your stomach. Lift one arm forward, thumb up. Lift the opposite knee just an inch off the ground. Hold for 5 seconds. Stay steady, no shifting. Switch sides. Repeat until you feel light fatigue. 3 times a week. Over time, you can lift the arm and leg fully, still slow, still controlled. This builds real stability, the kind your back has been begging for. But we're not done yet. If the muscles around your pelvis get weak, they tilt the joint, and that creates irritation. So here's the fix. Stand on one leg facing a wall. Light fingertip support only. Move your free leg in big, slow circles. Really slow. You'll feel the muscles on the outside of your hip working. That's exactly what we want. Switch sides. If that gets easy, lift the circle a little higher. Still slow, still controlled. This keeps your pelvis level and takes pressure off your lower back. And here's the final piece most people miss. Your lumbosacral joint and your pelvic joints work together. When one gets stuck, the other usually follows. That's why fixing both matters. Your back isn't broken. It's not weak. It's not too old. It's just been stuck, and now you know how to free it. And if you want to learn how to release your pelvic joints next, make sure you watch the next video. Because what I'm about to show you there could change how your back feels for years to come.